Hi, my name's Charlie, and I'm here to talk to you guys about healthcare. Healthcare is not something we think about. We just get sick and we go to the doctor, give them a copay or whatever, and that's it. Have you ever considered those that are a minority and how much harder it is to get access to affordable and good quality healthcare? Well, I'm one of those people, and I have a full-time job in healthcare. I'm not only Hispanic, but I'm also transgender. But the thing is it's so much harder for me to go to the doctors. I have to think a lot about more than just my health, simply because I don't sound like a man. Before I go over much more in detail, I wanted to touch briefly on some of the terminology I'll be using. So obviously you heard transgender, which is someone that doesn't identify as their given gender from birth. So when the doctor names you if you're a boy or a girl. And then we have cisgender, which is exactly that. You identify as your given gender at birth. And then we have those that exist outside of the binary, which are non-binary individuals that don't identify as male or female, or sometimes no gender at all. So I did want to give those guys a little bit of a heads up that we will be talking about mental health, and in particular suicide and anxiety and depression. So I just wanted to let you guys know. When you think about and hear the word transgender, you probably don't think about the pros. Instead, you hear about the common misunderstandings that is often created from the fear of the unknown. So what we don't know, we're afraid of. There are some claims that people say that being transgender is wrong, and that there isn't a possibly good explanation why someone doesn't feel like the gender they were given. And then there's other people that say being transgender is a choice, and that's something that we choose. Like we choose to identify as the opposite gender or no gender at all. And then you have the good old government, like President Trump, saying that it's too costly to cover some certain treatments for transgender individuals that are in the military, that are medically transitioning. So they are taking either hormone replacement therapy, they are going through some sort of gender counseling, anything that involves gender identity disorder, which is what the medical term is for transgender. When you think about healthcare, though, it's very cisnormative, and it has been for many years. But also, if you think about it, over the past maybe 5-10 years, the awareness of what transgender and individuals have increased, and which is good. I mean, you have Caitlyn Jenner that came out, and you have the Netflix star Laverne Cox. You have a lot of other individuals that are bringing awareness, which is great. But you don't really think about healthcare and mental health, let alone thinking about how big of an impact of a simple act of assumption can be on some transgender individuals. In 2016, S.E. James conducted a survey with transgender and non-binary adult participants, and 33% of them said they had at least one negative experience in healthcare that made them not want to go back. And the same group of transgender adults said that at least 42% of them have attempted suicide. And out of the group, 92% of them said that it was before the age of 25. If you think about it, suicide is the second leading cause of death in the United States, which is why healthcare is so important in making it more affordable and inclusive, and increasing awareness of just transgender individuals and non-binary will help lower these alarming numbers that we have seen in all these surveys. A lot of healthcare professionals are not educated enough to properly care and treat transgender and non-binary patients. Almost like the receptionist that called my legal name and not my preferred name because they feared a male patient would stand up instead. So, based off of that assumption, training is vital for all healthcare professionals, not just providers. And if healthcare clinics want to be more inclusive and universal for everyone. So, the thing that sucks the most is many providers don't choose to disclose if they're LGBT friendly, which makes it finding a provider that is specifically transgender friendly not easy, and it increases a lot of stress and anxiety for non-binary and transgender individuals. A lot of insurance companies are starting to cover hormone replacement therapy. For example, I pay $13 for a 3-month supply, whereas without insurance, I would be paying $23 for a 1-month supply. And that gets very costly out of pocket. The problem is, though, is that insurance companies aren't covering gender-affirming surgeries because they are experimental or optional, making the procedures very costly. Making the procedures cost a lot out of pocket. So those that are arguing that this is a choice are mistaken, because the American Psychological Association has deemed some of these surgeries as medical necessities for those suffering with extreme emotional distress in their bodies. So imagine spending your entire life savings on a surgery and hormones that will save your mental health and help you become who you've always meant to be. So pay attention the next time you go to the doctors. And I'm not telling you to violate HIPAA or anything, but just remember how you want it to be treated when you go to the doctors.